are you doing today? Good, that's great. Well, my name is Nurse Alyssa, and I'm going to be performing your cranial nerve exam today. And once I've completed all the tests, the doctor will come in, have a few words with you, and he'll perform any additional tests if necessary, okay? So I'm just going to go ahead and grab your file here. And I know that you have had a cranial nerve exam before, but I'm just going to, as I go along, walk you through some of the steps. And if you have any questions, anything you're wondering, any ponderings you want to ask me, please don't hesitate to ask. It's not a problem at all. Yeah, if you need to interrupt me to ask any questions or you have any concerns, yeah, please let me know. It's really important that you feel comfortable and you're able to express how you're feeling, and also that we document, any of those concerns or areas of interest that you want us to focus on. Okay? Wonderful. So let's go ahead and get started here. Had a chance to catch up on your file already, so we're going to be all set to go. So as you know, a cranial nerve examination, it's basically used to identify problems, okay, with the cranial nerves. And we do this with a series of physical examinations, okay, like your smell and sensation in your skin, as well as hearing, and eyesight is a big one as well, okay? So first, the first thing we're going to do is I'm just going to take a quick visual look at you, have a quick visual scan, just to make sure that, just off the bat, everything looks okay. And just check your eyes and your face, okay? Good. And then I'm also going to just check the back of your head, okay? Okay. No bumps or any swelling. Okay, that looks good. So far, right off the bat, everything looks really well. Next, we're going to start off by examining the first cranial nerve, and that is the olfactory nerve, which is your sense of smell, okay? And we have these little packets here, okay? These are little packets with different scents in them. And we're gonna do three scents, I think. And I'm just gonna open them up, and I'm gonna let you have a smell, and you let me know what you think it is, okay? Okay, so there's the first one. So go ahead and have a smell. You can tell me what you think that is. Good, that's right. Okay, very good. Now let's check the next one. Okay, here we go. Take a smell. What does that one smell like? Good. That's really good. Yep. Okay, we have the last one. So it might be a little bit trickier than the previous two. Okay, here we go. Have a smell. Okay, and what's that one? Exactly, yep, very good. Alright, that's lovely. Okay, so next we're going to look at nerve number 2, 3, 4, and 6. Okay, and those are the nerves which control your vision. Okay, and we're going to start off with a series of tests that will focus on the second nerve. Okay, so let me just first take a visual assessment. Okay, let me just see here. Doesn't look like there's any buildup in your eyes. Everything looks okay here. Okay. Alright, so that looks pretty good. Can you tell me what color shirt I'm wearing? Good, that's right. Yep. Can you tell me what color my hair is? Okay. And does it appear that I'm wearing lipstick? Okay. And what color would you say it is? Okay. Very good. Very well. So, okay. Next, we're going to move on to Snellen chart. Okay. And I don't know if you know what a Snellen chart is, but that's this right here. Okay, so with this chart, I'm going to point to a couple of letters, and I'm going to have you tell me what you see. Okay, but first I need you to cover up your right eye. Okay, and then can you tell me what this letter is, please? Good. Okay, and this one? Good. Okay, how about this one? Okay. And this one? Okay, good. And now can you please read to me the full line of the one you can see? So the line that you can read all the letters of, can you read them out to me, please? Uh-huh. 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 Okay. Yes? Yes? Okay. Okay, great. We're going to move on to the other side now, okay? So if you could please cover your left eye, okay? And I'm going to have you tell me a couple first, okay? So let's start with this one. Okay? 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 Okay, and this one? Awesome. And this one? Wonderful. Okay, one more. How about this one right here? Okay, great. So now, still with your eye covered, can you please read the full line of the one that you can see? Okay, all the letters, please. Okay? Yeah? Okay? Okay. Great. Awesome. Okay, that's a great job. So that's just the Snellen test. So you passed that one with flying colors. No problems there. So let me just jot this down here. So I got it here. Okay, now we're just going to do some simple movements. Okay, just tell me if the top hand or the bottom hand is moving, okay? Okay. 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 Now can you please tell me which finger is going out of focus first, okay? Okay? Tell me when you see it coming back, okay? Okay, good. Which one is going out of focus now? Good, okay. And it's coming back when? Okay, good. Okay, which one is moving? Good. And now? Good. And now? Good. Okay, now can I get you to please cover your right eye like this? Okay, and I just want to check for any blind spots. So please let me know when you see my hand disappear and then reappear, okay? Okay? Okay, tell me when they disappear. Okay, and tell me when they reappear, please. Okay, good. Okay, one more time, please. Tell me when they disappear. Okay, and when they reappear, okay? Okay, great. That's really good. You're doing a great job so far. How are you feeling? Are you feeling okay? Yeah? Okay, good. Do you have any questions? Okay. Good. I just want to make sure that you're doing okay. Because I know sometimes these tests can be a little nerve-wracking or uncomfortable. Although some people say they're quite relaxing, but, just want to make sure you're comfortable. Alright, so the next thing I want to do is just a few more hand movements, okay? So let me know when you see my hand moving, okay? Good. 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 Good, okay. So next we're going to do some lights. That's the sensory component of the reflex. So we're going to focus basically on 3 different areas, okay? I'm going to be checking for a direct response, a conceptual response, and also accommodation. Alright, so I'll explain each of those as I go along. But as I said, for this step, I will be using the light, okay? So if it becomes at all too sensitive for you, please let me know so that I can stop, okay? I'm also going to dim the light a little bit for this one, okay? So it'll be easier for you to see the light, okay? I think that should be good. So what's going to happen with the direct response is I'm going to shine the light into one of your eyes, okay? And when I shine the light into that eye, I'm checking that pupil to make sure that it's constricting, okay? That it's getting bigger and getting smaller appropriately. So I'm going to do that with your right eye first, okay? So I'm shining the light into your right eye, and I'm only going to look at your right eye, okay? Okay. Okay. So again, I'm checking for your direct response here. Is your pupil dilating when I flash the light? Is it constricting? Okay. Good. Good. Very good. Okay. Now next, I'm gonna flash the light in the same eye, but this time I'm checking for something that's called consensual response. So what that means is, even though I'm shining the light in this eye, I will be checking to see that the other eye is constricting. Okay? I want to make sure that they're simultaneously constricting. Okay? So again, I'm going to shine the light into this eye, and this time I'm going to be looking here, okay, for a consensual response. Okay. So I'm shining the light here, checking for consensual. Okay, consensual. Shining the light here. Good. And here. Okay. Just do it a bit more consensual. Okay. Shining the light on this eye and checking for consensual. Consensual. Okay, checking. Good. Looks like they are constricting symmetrically. Now I'm going to do the direct response again. This time I'm going to do it in this eye. Okay? So I'm shining the light in this eye and I'm looking for a direct response. Okay? I want to make sure that your pupils, good, are constricting. So I'm checking here. Direct response. Okay, direct response. Direct. Okay. Okay, good. They're constricting very well. So now we're going to do the consensual response again. So I will again flash the light in this eye. And instead of paying attention to this eye, I'm going to look at the other eye to make sure that it is constricting, okay? And I want them to be consensual, symmetrical. Okay, so I'm shining the light in this eye, and I'm checking the other eye, okay? Okay, checking for consensual. Okay, good. 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 Consensual. Okay, consensual on this side. Okay. Good. Okay, good. So that looks really good. Your direct response, your consensual response, They're both performing normally. Both your eyes are constricting in the best manner possible. Your pupils should dilate 3 to 5 centimeters. So you're at about a 4, so that's really great. Next, what I want to do is accommodation. So basically what that is your eyes are going to fixate on one object. So we're going to use this flashlight here, okay? So I want you to look at this pen, and I want you to focus on it as it's coming closer to you and as it's going further away from you, okay? So here we go. Just focus. I'm again going to be watching your pupils, okay? And I just want you to focus on this torch. Okay, just want to make sure that your eyes and your pupils are fixating on this object. So please just watch this object, okay? This object, okay? Just focus on it. Okay. Okay. Just going to move it now in different directions, but I still want you to focus on it, okay? Because I need to be watching your eyes to make sure your pupils are constricting. Okay. Very good. Okay. Just put that down here. So your eyes, they are dilating perfectly, which is a really good sign, okay, that you're not having any damage with those nerves. And that's going to be it for the sight part, okay? So I'm going to go ahead and just add the light back, okay? So next what I'm going to do is I'm going to test the third, the fourth, and the fifth nerve that's associated with vision, okay? And we do this to make sure that there's no double vision or blurred vision. Okay, so I'm just going to take this pen. I'm going to hold it up in front, and I'm going to move it right to left and up and down, okay? And I just want you to focus on the pen. Don't focus on anything else. Just focus on the pen. Even if it goes out of sight, yes, please just focus on the pen. Just seeing how rapidly your eyes can shift. Okay? And even when I do it slowly as well. It helps a lot in the assessment. Okay. Good. Yep, you're doing really good. Okay, that's great. Very well done. We can move on now to the fifth nerve, okay? Which is the trigeminal nerve. And this is basically responsible for transmitting things like sensations from your face all the way to your brain, okay? And it also contributes to the motor muscles that are associated with chewing. So what I'm going to do first is I'm going to check your face in different areas of your face with something, with just my fingers, as something sharp and then something a bit dull, and you should feel the same feeling on all parts of your face, okay? So let me know what you feel, okay? So I'm just gonna touch here, okay? And with this test, I just want to make sure I'm not stroking like this. Okay, I just want to touch just like very gently. Okay, 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 making sure it's the same. Okay, 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 good. Great, now I'm going to check with something a bit softer, okay? So I want to see if your senses can pick up the sharper and the lighter sensations, okay? Ready? Okay, right here. Okay, great. That's really good. Now, I just want to check your mouth. Can you just open your mouth for me, please? I just want to check here. Okay. Okay. Just going to touch your jaw here. Make sure that it feels okay. 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 Now I'm just going to open your mouth a bit. Just gonna put my hand right underneath your jaw, and I'm just gonna tap you here really gently. Okay. 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 Good. Just wanted to check your reflexes there. Okay, and I felt around your jaw to make sure that it was symmetrical on both sides, which was great. We're going to move on to the 7th nerve now, which is the facial nerve. It's basically the motor component for your face muscles. So can you please just wrinkle your eyebrows, please? Lift your eyebrows up high. Okay, good. You can see the wrinkles there. Good. Okay. Perfect. Okay, good. Okay, show me your teeth. Okay. Good. Just feeling around here. Okay, now puff out your cheeks, please. Okay, good. Everything is looking good here. I'm just tapping on your face to make sure that there's no weakness or sensitive areas. Okay. Alright, great. So we're going to move on now to the 8th nerve, and that's your hearing. Okay? So I want you to cover one ear, please. I'm going to whisper something into your ear, and you tell me what it is, okay? So cover your ear. Okay. I love chocolate. Okay, and what did I say? Okay, and cover up the other ear, please. Okay. I love chocolate. And what did I say? Okay, good. So we're going to do it one more time, okay? This time I'll say something different for both ears. So cover up this ear again, please. Okay. Hello, how are you? And what did I say? Okay, great. And cover this ear, please. I have one cat. And what did I say? Okay, great. Really good job. Okay, now we're gonna make some sounds with a few objects, and I need you to tell me when you start to hear the sound and when the sound starts to dissipate, okay? Okay, here we go. Ready? Tell me when you hear the sound and then when you don't hear the sound anymore, okay? Okay, good. Good. Okay, let's try that again. Tell me when you hear the sound, and then when you don't hear the sound anymore, okay? Good. Great. Okay, let's try it with a different type of object, okay? So tell me when you hear the sound, and then when you don't hear the sound anymore, okay? Good. Okay. One more time, please. Tell me when you hear the sound, and then when you don't hear it anymore. Okay. Great. Okay, we're gonna try one more sound, okay? So again, let me know when you hear the sound, and then when you don't hear it anymore, okay? Good. Okay, one more time, please. Tell me when you hear the sound, and then when you don't hear it anymore, okay? Great, good job. Okay. So, you did really good on that. Okay. So I think we're gonna skip 9, 10, and 12. I'm gonna have because I feel like I did the mouth. Okay. And can you just say ah again for me, please? Ah. Okay. Keep it open. Okay. Yeah. I think it's all good there. And we'll have the doctor perform the last part when he gets in here. Okay. What's that? Oh, okay, sure. You just want me to check again for your direct and consensual response? Sure, I can totally do that. Okay. So let me just get the flashlight here. Okay. So remember, I'm just gonna flash the light in this eye and take a look to make sure that the pupil has dilated or it's constricting. Flash the light in this eye and I look in this eye. Okay. 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 Great. So conceptual response, I'm going to flash the light in this eye and I'm going to look at this eye, okay? Conceptual on this side. Okay. Okay. Conceptual on this side. The light is flashing on this side, but I'm checking this eye. Okay. Great. So let's do it on the other side, okay? So I'm checking the direct response on this side. Good. 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 Okay. Good. Okay, this is the direct response. Now I'm going to look at the consensual response, okay? So I'm going to flash the light in this eye, but check this eye here, okay? Okay. Okay. This is the consensual. Okay, and let me just quickly just rotate like this, okay? Good. Great. Okay. Everything looks really good. Your eyes are dilating really well. So I definitely wouldn't be concerned about that. No. because like I mentioned, 3 to 5 is, you know, the average, but sometimes a little bit more, like 6 or something every once in a while. It's not a problem. If it does continue to happen though, please give us another call or talk to your eye doctor about it. Okay. So I've got everything ticked off here for our cranial nerve exam. I'm going to leave this here for the doctor so he can just take a quick one over on this before he performs a few more tests, and then he'll have you out of here really soon, okay? Alright, it was nice to meet you, okay? Alright, take care. Okay, bye.